As we can see, since 2016, the number of internally displaced people were more or less the same, and they spike only in 2022. And actually, also, as we can see, the number of IDPs since 2022 was also quite more or less stable. But geography of this change was quite different if we look on different years. So in the very beginning of 2022, in general, as we can see, there is data from UN humanitarian response plan. The people who were targeted there actually were a little bit more than 11 million. And if we look on the geography of these targeted people in need, are quite, I would say, homogeneous if you're looking on different regions in Ukraine. But if we would be moving forward, we can see that each year the number of targeted people, actually people in need, are a little bit moving towards the east. And if you can see, for example, how many people are in need, if you're looking on 2024, and how many are targeted in UN response plan, there is a huge prioritization, I would say, toward the east. And the number of people in need, as you can see, this is this blue color, and if how many people are targeted, this is in this orange color here. One of the reasons of this kind of switch and this movement towards the east was actually intersectoral research of the severity of needs. And according of such a research, we can see that severity of needs are more focused to the east. They are kind of concentrated closer to the front line as well as to the border of Ukraine. That is why, for example, if we see already for reprioritization of the humanitarian response plan in 2025, the number of people who are targeted in the Western Ukraine and the Eastern Ukraine are absolutely different. And what it says, what it can say for us. First of all, we understand that when the first crisis hit it, and it was a huge movement of the people to the Western Ukraine, to the safer area, as well as to abroad. A lot of interest was toward these people there, and the assistance were provided there. But now, when we are talking with the people and asking them why they are coming back to Kharkiv region, Dnipropetrovsk region, Mykolaiv region, and so on, where a majority of assistance are, they are saying that they are uh, facing in other regions of Ukraine the situation when they cannot find a proper assistance and any kind of means of living there. So they are moving to these territories where they can see such assistance. And this is one of the I would say challenging point if you are speaking about any kind of rethinking of the migration processes is if our assistance can create a pooling factor for people to go to the dangerous territories or not. And this is something that I believe would be important to rethink in general, and not only on the example of Ukraine, but I believe that such a factor, such a situation can be faced in other territories as well. Um, if we, for example, will go and see how the assistance in 2025 was distributed, we can see that this is not really following this a clear map of reprioritization, because still, even if we are speaking about central and western Ukraine, number for plans are quite low. Number of people assisted are much higher than it was planned. So what does it mean in general? It means that the needs are still there. The needs are all over Ukraine, but due to the development of the reprioritization plan or the UN agency plans, there is such a kind of movement forward. So this is one important point for rethinking. Second one that I also would like, to show you, based on the context changes which is going on in Ukraine. This is the change of the sector or cluster of assistance. Um, Here we can see how the response plan in 2022 look like if we are speaking not breaking through the geography but through the sector. And we can see that a lot of attention are, for example, for food security, where the numbers of beneficiaries are the highest, or health topic. Yeah. Also, we can see that CCM cluster, which is this is abbreviation, means that this is collective center management. Yeah, this cluster for collective centers management. So this is means that there is a quite substantial number of people who are living in collective centers. So this is more than 650,000 of them. If we are moving for next years, for example, 2023, we can see that there is kind of a rethinking process are going on, and the number of people targeted, for example, for food security or for health, are going down, as well as for the people who are living in collective centers. And actually, when moving forward in 2024, this change is even more dramatic. We can see it more clearly, like from 2022, where the number of targeted were, for example, for food security, 5 million. 23, it's already going down, and if we are going to 2024, there's number is already 3 million. But in general, the topic of protection, as well as shelter and wash, actually is growing. Um, and if we would look, will be looking in 2025, this is even kind of more visible, in a sense that the number, the percentage of the people targeted with the protection or health or other kind of longer sustainable type of assistance are growing. And what is the reason, from our point of view, from our kind of analysis of this topic, is that actually this numbers are this kind of tendency is tightly connected with the character of the crisis that we are facing in Ukraine. So we are not facing a short-term crisis, but we are really facing a protected crisis. And through this change, we can see that the assistance which is connected to the longer term work, which is connected to the more deep engagement, is kind of is growing in this context. And in Ukraine, what we can see, this is tight connection between the number of people who are in dramatic crisis humanitarian needs, and those who are moving to more stabilized situation and who need assistance which give them a movement forward, a possibility to live forward, not only to survive in a humanitarian crisis, but really think how to establish their lives in time of war, in the country of war, and how moving forward. So in this case, we actually in Ukraine are facing not a classic I would say situation when we have a humanitarian crisis which is strike strongly on a certain period of time, create a huge movement of the people. People move to another area. They've got some kind of assistance, and after that, there is reasons for humanitarian crisis is eliminated, and we are moving in the stabilization, early recovery type of phase, and people start to moving forward in the situation of Ukraine when when the humanitarian crisis is protracted, when we have a multi-year humanitarian crisis which is still going on. We still don't know how the situation would be going on different territories, as well as for different people in different situations. We have at the same time different phases. So we still have people whose life and health depends from assistance, and they are in deep severe humanitarian needs. But also we have people and some territories which need a kind of more early recovery or even development type of assistance, helping people to moving forward, yeah, to to keep them on more safer, stable phases. Why this conclusion, I believe, is important, because in general, when we are looking on the mobility throughout the world, we also can see quite often a protracted type of crises, when we cannot say that, okay, in a certain area crisis strike, there is a humanitarian need, we provide a humanitarian need, we help people, okay, let's move forward to early recovery. Quite often we need to kind of deal with this protracted type of crisis, and we need to think how to do assistance on different phases of humanitarian crisis at the same time. So for some people, they still need humanitarian type of assistance, and in other early recovery or development. And quite often it can be the same people who are moving through this type of assistance. Another challenge that coming from this kind of conclusion is that we need to rethink how international assistance, or in general institutional assistance of the country for such people are provided in terms of mm, tight, comprehensive approach between the humanitarian actors and development actors. And this is exactly what we can see, that there is a huge gap between this type of agency who provide humanitarian assistance and those who are providing early recovery or development assistance. In practice, what does it mean? It means that some people who've got a humanitarian assistance, for example, they were evacuated from some region near the border with Russian Federation, which is right now in occupation. Definitely, this is humanitarian response. They've got an assistance. They moved to some collective site somewhere, for example, in Poltava region, and they have stabilized position there. But no early recovery or development actor is coming to them after their stabilized situation, and quite often it forces these people or to go back to Sumy itself or to their relatives somewhere in Sumy region and be again in humanitarian type of crisis, asking for more humanitarian assistance instead of, if we would have some kind of chain between humanitarian actor and development actor who can pick up this people and provide them assistance. And it doesn't mean that it should be always international assistance. It can be done by national actors who can for example, step into social protection or some other type of assistance, which have more kind of development type of response. Um, actually, uh, if we look for in general in the situation of Ukraine, this is we also facing this kind of a challenge when, for example, if we look in general how many partners are engaged in UN response plans. There is more than 400 of them, but almost 300 of them are actually national actors, and this is actually actually creating a great breach between this humanitarian and development assistance in case of rethinking of the approach. Why? Because majority, a huge majority of all the international humanitarian actors, international NGO who came into Ukraine, in majority of cases, they have this humanitarian mandate. They are focused on pure humanitarian type of assistance, and they do not have this kind of an approach of linkages between humanitarian and development assistance. So, like this quite often we can hear this humanitarian development nexus or a humanitarian development peace building nexus. Yeah, but there is quite different names, but still this kind of an idea in case of Ukraine is not working because majority of funding has a humanitarian kind of background, and through international NGO and through UN agencies they are going to national NGO, and national NGO quite often working mainly on humanitarian type of response, even in their kind of identities they have this strong uh, idea of bridging humanitarian and development assistance. So in case of Ukraine, we have a great opportunity to do such a humanitarian development nexus, but for now, till now, we are facing a big failure on this because of the nature of resources and because of the different streams of financing of humanitarian type of assistance and development type of assistance, which I think need to be rethinking. That is why this is kind of my third point on this. How Caritas is responding on such in such a circumstances. First of all, we have a huge growth in our personnel and in our in our type of work. So if we speaking 2022 before this full-scale invasion happened, we have like about 50 people in national office and 600 people in local organizations. Now, yeah, it's grown like 5 times in the national office as well in the local organization. Like this is 3-4 times growing, as well as the number of volunteers just exploded in a whole Caritas network. If we are looking in context of geography, it's also was quite big explosion. Uh, in the beginning of 2022, we have about 25 Caritas centers. Now we have almost 50. As well as we were working about 350 local communities. Now we are working more than 1,000 local communities. And here on the map, you can see that the Caritas organization covering actually all over Ukraine, but with a much higher density of the number of organizations in the western Ukraine. This is actually has very simple and obvious explanation due to the density of religious community. Ukrainian Greek Catholic Church, which is actually is a founder of Caritas Ukraine, has a much higher density of the parishes of the religious community in the western Ukraine, which are the base of the creation of the Caritas organization. And this is why we have such a higher number of this Caritas organization in Western Ukraine, and also it's showing that um, doesn't matter what the humanitarian financial streams look like, and even if they are more focused on the east, the Caritas is kind of engaging quite a lot of local resources, and they provide assistance based on these resources that they are fundraising, and that is why they still keeping this work in the Western Ukraine quite strong. But still, we are among those organizations who are feeling this. Decreasing of the resources provided for assistance for Ukraine, and actually we also facing that some of our activities in some location should be scaled down or closed because of this financial topics. If we would like to see the sector split of the work of Caritas Ukraine, we are actually working in all the major sectors. Definitely, we are working in the sector of provision of food security, as well as on the topic of access of the people for the water, sanitation, and hygiene, and covering hygiene needs, as well as Caritas is quite active in sector of shelter, which is providing a temporary solution for housing, as well as a longer term of restoration of the damaged houses. The only thing that I would like to underline on, if we are speaking about this sector, is that Caritas is focused mainly on the most vulnerable population. We are working with on the household level. That is why Caritas is not involving itself in big infrastructure restoration or any kind of big rebuilding projects, but really focusing on provide provision assistance on household level. Also, we have quite strong approach on provision of multi-purpose cash assistance, which we see as the most dignifying type of assistance for beneficiaries, because it giving beneficiaries a possibility to choose by themselves what they would like to do, how they would like to spend the resources they need, where their essential needs they have. That is why we also working quite strongly on their livelihoods needs, and includes assistance in employment, as well as vocational training and self-employment, which is also we see as a life, especially for those who has experience of having self employment business activities, and also creating some places for job. Also, we are working quite strongly in the social protection and the protection of human rights field, providing case management as a crisis consultation, as well as a juridical consultation. Also, in the current situation in Ukraine, we understand that psychological resilience is one of the important topic. So we are quite strong and quite engaged in this as well. As well as working in the field of inclusion, helping persons with disabilities and their families. Another big service for us is actually healthcare, as well as a different type of assistance for people who are kind of in very dramatic situation, including the elderly people, yeah, who are in huge need of the health care as well. Another sector of our work is definitely concerning the topic of education and protection and child protection. We have a lot of different centers all over Ukraine where we have strong assistance for all the children who are in very critical situation. And also, you had already a possibility to hear Irina Mayevska, who is responsible for our safe migration topic, where we are promoting a safe migration, advocating for interest of and protection of migrants and returnees, as well as combating of human trafficking. This is actually the list of 11 different programs that I'm responsible right now. And as you can see in our structuring it, we do not have we do not have a kind of difference between humanitarian response and development response, because we see this as a kind of joint approach, where we see that in different depends on the financial streams we could provide assistance. It depends on these tasks, but in our strategy, in our thinking, we already developing this nexus approach, where we understand that we need to move from provision of humanitarian assistance into more sustainable solution for people and helping people to stabilize their situation and to move forward. That is why we took actually in 2023 our kind of deeply considered or deeply discussed decision that we do not have such a split on humanitarian and social or development type of project, but we have rather split on the sector which I already listed. This is 11 different sectors in our work. Besides this 11 programs, we also have a couple activities focused on the work with the communities and building the community resilience. It actually includes work with volunteers, strengthening the social cohesion, reinforcement of the religious community, as well as promoting of peaceful coexistence in communities. But this is actually more focused on the community development. Actually, if we are looking on the this first 6 months of 2025, we actually reached more than 40,000 of unique families to whom we provided assistance, and this is actually I have like more than 60,000 of family members of unique beneficiaries. And actually, why we are speaking about this unique families, because quite often our assistance is comprehensive. So, for example, family is evacuated from Donetsk region. So they've got our assistance for evacuation. After that, they need to do some paper, yeah, to restore some documents that they are lost or they need to do. So they are getting our legal consultation, as well as, for example, some of family members have severity health care needs. So we could provide their health care assistance. So we have this comprehensive approach, and actually for Caritas Ukraine, this is one of the most important approach, and this is where we see this connection between how to say, bridging this this sides of the gap between the humanitarian and development. In general, if we try to look as how the percentage in different sectors of our work, we can see that huge numbers of our beneficiaries are actually in the wash sector, which is very easy to explain because we actually help in different communities to restore their boreholes. So all the all the people who are living in this community are getting access to the water, which is kind of jumping the number of beneficiaries who can get this assistance. But also we quite active in education, in general protection, in child protection, as well in the shelter, which is only in a shelter all during all this 3.5 years. We already did a renovation for more than 10,000 different households. Yeah, so this is kind of a brief presentation about the context, the main factors that I wanted to bring your attention in terms of rethinking of the immigration processes, and yeah, and how Caritas is finding its way in all these kind of challenging circumstances, and how our response is looking like. And I'm open for your questions.